It's time for the Half Hour to Health with Dr. Bob and Debbie DeMaria. Call a friend or family member now and let them benefit from today's exciting and informative program. If you want to lead a healthier life, the time is now.
Hello, this is Dr. Bob and Debbie DeMaria. Welcome once again to our Half Hour Health program. And tonight, we're going to talk about kids' health. So right now, I'm going to give you a few seconds. You call somebody up on the screen. And if you're watching me on the internet right now, you tell somebody about this particular video. You know, Debbie and I, we have been so blessed. We have two healthy adult sons. And you know, Deb, wasn't even planning on saying this. Both of them don't wear glasses, and I know at one point they had 20/10 vision. But I think what's most significant is neither one of them have any fillings in their mouth, and they don't have fluoride treatments. And we don't use fluoride toothpaste. That's huge. They take no medication. They've never taken any medication. So if Debbie and I can do that the last 30 years, and the environment in our society really hasn't changed that much, I know you can too. So today, we're going to talk about kids' health. Now, I'm going to shock you. You say, shock me, Dr. Bob? Yes. Kids need chiropractic care as much or more than adults do. Do you want to know why? Because all of us enter the planet the same way. We have to be born. And the birth process is one of the most traumatic experiences that anyone can go through. Now, I'm going to burst your bubble a bit right now because some of you know somebody that had a C-section. Do you know that having your baby via a C-section is actually more traumatic to the child than natural vaginal childbirth? And do you want to know why? Because when that head comes down the vaginal canal, the muscles of the vagina are squeezing that head a bit, getting that muscle toned up, getting ready to come out, getting ready to go. Let's get this baby out of here. But when you do a C-section, there's an incision. The baby is taken out. Oh my gosh, and it's into this world. Total different physiology. So the number one cause of subluxation is the birth process. You say, Dr. Bob, you really treat kids? You crack their necks? Well, not exactly what we do. And this is going to sound pretty amazing to some of you, but we do it all the time, is that we actually have the parents grab the child by their thighs, and we have them hold them upside down for just a few seconds, and we see which way the head shifts. The way the head shifts is usually the way that the spine is out of alignment. We can actually do the thermography on them. I have a little instrument. It's called an activator instrument. It's an adjusting instrument. It's not traumatic, but I can tell you recently we had someone who came in the office. It was the dad, and he was so proud. He brought his new baby daughter into the office and with the mom, and everybody was cooing over the baby, and I understand. So one of my patients just happened to be there, the way that God set it up, and she looked at the mom and said, have you had the baby checked? And the mom looked at her, baby checked? She said, yes. Did you have the baby checked? And the mom said, no. And then my patient said, well, how old is the baby? 3 weeks. And she proceeded to tell her that on the way home from the hospital, she had her baby checked 25 years ago, because her son is obviously 25 years old right now, and her child had regular chiropractic adjustments its entire life. So I talked to the dad, I talked to the mom, and the dad came over. We checked the child. We hung the child upside down. The child was shifting off to the left, made the appropriate and necessary with the instrument correction. Called the dad that night to see how the baby was. And Dr. Bob, I just love when they do this. You are not going to believe this. So it gets really very good usually after this. He said up to this point, every time the child ate, it would cry for 1/2 hour to an hour and a half and cry itself to sleep. I don't know what you did, but whatever you did, after we fed that child, the baby went right to sleep. Don't you just love that, Deb?
Well, you know what, Dr. Bob? It's not just that. But what about they poop on the way home? They've been constipated, and after you administered the adjustment, they poop on the way home. Or if the baby had colic, that all of a sudden after the adjustment, the baby is calm. Or if the baby had an ear infection, after the adjustment, the baby cleared up. Dr. Bob, it's definitely not just the miracle of the adjustment. You've got to tell us what it is.
I'm going to let you hold this. This is very exciting. And this is the spine, obviously. The spine is made up of 24 vertebrae that move. I'm going to teach you a little physiology right now. Your brain sits in the skull. Well, it continues on as a big nerve called the spinal cord. So these tiny little vertebrae can go out of alignment. And they can go out of alignment, putting pressure on sensitive nerves. Now, the child may cry a lot, and you might be annoyed, especially if you're a first or second time parent. But actually, when I touch that child's spine that I was just telling you about, every time I touch that child on the left neck, it would do this. It would move away. The baby didn't have to say anything. Parents saw it. That child was in pain. And then I did the same thing along the upper back. And every time I would get to this spot, the baby would do the same thing. It would move away. So, hello, the baby was experiencing discomfort. So we use our little instrument. It's a little instrument that does a little noise and a little bit of movement like that. It doesn't take a lot of force. So what I want to open up your mind with is this. Your spine is like a set of circuit breakers. And these breakers can go out of alignment. And they put pressure on nerves. Debbie just mentioned two of the most common challenges that we see. Constipation and colic. So if you're watching me right now and you have a grandchild or a child next door or a little baby, just very gently, just run your fingers up and down the spine. You'll notice in that mid-back area, if they do this kind of motion, you need to call Dr. Bob. Now, we have a thermography unit. We have a piece of equipment that costs several $1,000s. It's an infrared scanner. This is like CSI. This is forensic medicine. Hello? We can run that thermography right along the spine, and it doesn't tell us exactly what vertebra is out of alignment, but it's going to tell us increase or decrease temperature. We don't take x-rays of 3-day-old children. We can use the thermography unit. We can touch the child's spine, but what's amazing is if that child does not get an adjustment, they could have health challenges forever. You can say, Dr. Bob, that's a pretty bold statement. I've been doing this since 1978. And after you touch 600,000 or 700,000 people, you can make bold statements. So we had one child that came into our office, was 2 weeks old, and was constipated since birth. They wanted to put a suppository in this child's rectum and or have the mother start giving the baby Caro syrup. Well, the grandmother happened to be a patient of mine. She said, Dr. Bob, my grandbaby is just not doing this. So they brought the child in. We did everything I just told you. Did the instrument right here in this spot right there. L1, first lumbar vertebra. And as Debbie said, on the way home, actually it was at Toys R Us, the baby pooped all 2 weeks of poop. And guess what? It's been pooping ever since. So Dr. Bob, so what are you saying to me? Here's a challenge I'm going to give to you right now. I want you to go back and pull out some old pictures. Pictures when you were a kid. I want you to go in the mirror right now, or after we're done with this program, because you don't want to miss this program. And I want you to close your eyes, take your head back and forth, and look at the mirror and look at your posture. And if your head is tilting off to the side, go back many years when you were a child. And you're standing there with the whole family and proudly displaying wherever you were at in the United States, and your head was tilting off, more than likely you were subluxated since birth. But let me talk to you about this. The #1 drug that children take in America today, the #1 drug, 45 million prescriptions were used last year, asthma drugs, Debbie. The #1 drug, 45 million. And you can say, Dr. Bob, can you help asthma? This is what we do. We don't help anything. What we do is we help the body heal itself. And I don't want to sound metaphysical. I don't want to sound mysterious. This is basic physiology. All healthcare providers learn this in anatomy and physiology. And I know many of you, because the health industry is the biggest industry in the United States right now. Do you ever wonder why it's so big? Because everybody's so sick. Well, we all know the brain continues on as the core. The brain's the master computer in the body. How do you think the rest of the body knows what to do? Because of nerves, brain cell, tissue cell. Well, if there is misalignment affecting the nerves that go to the lungs, you're going to have breathing challenges. But we also see breathing challenges in children today, because Debbie and I know that half of you watching us right now are single parents, divorced, or remarried. Do you know that that creates stress on your child? Do you know that adrenal gland exhaustion is one of the leading causes of asthma? But let me stretch you a little bit more. Eczema. Eczema is very common today. We adjust the spine for eczema, but do you know what else that we do? We supplement with a product called Bio Omega 3 from a company called Biotics Research Corporation. We have found that eczema is actually an oil challenge. But you know what else I've learned about eczema? Kids who have asthma usually have eczema. Kids with eczema usually get asthma. So we know that oil has a lot to do with what's going on inside of the lungs. And a few other items, and I know that you've been watching us for years, and we talk about this perpetually, but inside of my hand right now, this is sugar. This is sugar, the amount of sugar in a 12-ounce can of soda. Sugar, now listen, I'm going to word this to you, handcuffs the immune system. I know many of you watching me right now as adults are addicted to sugar. You have sugar in your home. Your kids are addicted to sugar. Sugar paralyzes the immune system.
Dr. Bob, you know what? If you look at that and you said a magic word, 12 ounces. Who gives 12 ounces anymore? They're the big this and the supersize that, and it's huge. So you are getting really the double amount in just one.
I know.
But how many people start their morning off with one, go midday with another, and on the way home from wherever that might be their third? Can you imagine how much sugar, hidden sugar, is in their body besides what else they're eating?
Well, I know the sugar will help, and it does paralyze the nervous system. So we've talked about asthma and colic and constipation. One of the most common challenges that we see in our practice are kids that have ear infections. And almost inevitably, they either had a traumatic birth, the upper part of their spine, right up here at C1 and C2, is nearly always subluxated. So you could have a child right now, and you could take them to your healthcare provider, and they could put them on a round of antibiotics, and they could be on it for a season, and once they're off the antibiotics, it comes back again. But I know, and truthfully, on top of it, healthcare providers know today that antibiotics should not be the first choice when it comes to otitis media, because they know that over time, most of them are going to resolve themselves. What we encourage our patients to do, besides having their children or grandchildren's spines checked, you have to eliminate dairy products totally. Some of you are putting your kids on wheat products much too soon. We don't even promote wheat products in our practice. Do you know that today 1 in 6 people have celiac disease, and a part of that is because of the genetically modified wheat? You would do your whole family a favor by minimizing wheat products. I'm not telling you ever to have wheat again, but if you have a child with chronic ear infections, you want to get them off of peanut butter, you want to get them off of yogurt and dairy products, you want to minimize the sugar. You say, oh, Dr. Bob, that is so hard. Well, I'm going to tell you right now, they're going to put tubes in that child's ear, and that child's going to have potential to have some hearing loss because of those tubes. What I would suggest that you do is exactly what I just mentioned to you. Make those appropriate and necessary dietary changes. You know, Debbie and I have been really blessed. We've written 7 books. This book is on ADHD, and I'm not saying that your child with the tubes in ear have ADHD, but this is a drugless family guide. In this book, we tell you what to eat and what not to eat, and I'll close with this before we take our break. Gluten is in rye, wheat, and oats. Gluten causes the villi, the little projections in your intestines, to stick together, so your body's not able to absorb nutrients. And because it cannot absorb the nutrients, what's going to happen is your body's going to be in a lower state of health, and you don't want your body to be in a lower state of health. So we're going to take a short break and we'll be right back. Hello, my name is Dr. Bob DeMaria, and I'm going to talk to you today about some of the books that I've been blessed to write. The very first one I'm going to talk to you about is Men's Health, the Basics. Men suffer silently every day, and they don't know what to do. Most of the time, they don't even want to go to the healthcare provider. 40% of you have never even had your cholesterol checked. This book will help answer your questions. At the end of every chapter, there's action steps that you can take. There's a chapter in here called Winning the Pain Game, because I know that many of you have pain. Ladies, you usually make the health decisions in the family. And I know so many of you are tired of medications. Dr. Bob's Drugless Guide to Balancing Female Hormones is going to answer the tough questions that you deal with every day, whether it be a hormonal issue, a pain issue, an adrenal gland issue, a weight loss issue. Dr. Bob's Guide to Balancing Female Hormones and the Men's Health book both have weight loss chapters. This book is about sex and intimacy. It's a continuation of the hormonal books I was just discussing with you. If you're having any kind of sexual impairment, this will answer your questions. Dr. Bob's Trans Fat Survival Guide and Dr. Bob's Guide to Stop ADHD, it's about helping someone emotionally, with behavioral, depression, and other type of challenges. Dr. Bob's Trans Fat Survival Guide will help you understand what fats you should and shouldn't be using. So many people are concerned about detoxification. This book right now will give you the action steps that you need to take to purify your body from the inside out. And nobody should be without Dr. Bob's Guide of Optimal Health. There's over 400 pages of information, a tip every day with a prescription to natural health. Get these books. I promise you, you'll be glad you did. Hello, this is Dr. Bob and Debbie DeMaria. Welcome once again to our half-off health program. And if you watch us, the first segment, we were talking about kids. We're going to continue talking about kids. If you're watching us on the internet right now, I need this to go viral. I need you to pass this around the world because we're here to make a difference. And if you have a child that's sick anywhere in the world right now and they're not getting better, just go to CLE, Cleveland, Ohio, look us up, Dr. Bob, and we will make a difference in your life. I promise you that. Now, we have so much to talk about in a very little bit of time. So I'm going to share a few thoughts with you. If you have a child that has perpetual fevers, of course, always go to your conventional healthcare provider and rule out any infection. But this is what I've learned. This is a secret. Dr. Bob patient secrets. It's usually lack of calcium. We use a product, and you can get it from our website, called CalMagZyme. What I have learned over time, and it actually happened to myself when I was a kid, when your body is starting to go through a growing spurt, it really needs calcium. Calcium kind of like puts the fire out. I am not telling you to or not to take any pain relieving medication. I personally would not. Get yourself some calcium, magnesium, CalMagZyme, calcium citrate. Have it available in your household. It'll make a huge difference. Empty stomach, 3 or 4 of our CalMagZyme every day. Not dairy, not cottage cheese, not yogurt. And by the way, if you have a child that has a chronic ear infection, we use something that's available on our website called IAG, Indigo Alpha Go. IAG and Cytozyme Thigh. It'll make a huge difference. Repeat this. I know you'll learn a lot. Let's talk about growing pains. Growing pains are really common. And it's usually between 8 and 13 years old. You'll have a child, oh, Dad, it hurts. Oh, Mom, this hurts. What's going on? Especially if they have cold hands and cold feet, they could have a low thyroid gland. If they have wide-spaced teeth and they always complain about being cold and their body has migrating pain, well, on our website, we have a liquid iodine. And depending on the age, you could very easily just follow the directions on the liquid. It'll help make a difference. But if you're concerned about iodine, we've been using iodine for years without any problems, by the way. You could also go to our website and we could do a urine dipstick iodine if you want to feel a little bit more comfortable with that. So fevers and or growing pains, always think calcium. So Deb, there's a lot more.
Well, I think that, Dr. Bob, one of the things that you need to talk about is tummy aches, because kids a lot of time get tummy aches. And I think it can be indigestion for sure, what they're eating, but there's a lot of other items there that we need to touch on.
Well, you know, it's kind of interesting, Deb, because a lot of times it could be food combining. Everybody pushes milk and pushes dairy products. If you have a child, and I don't want to make a big deal about this, eliminate their wheat breakfast cereals and get some brown rice breakfast cereal, or try some quinoa and use an unsweetened coconut milk, or an unsweetened oat, rice milk, or unsweetened rice, almond, and oat are the best. You could also put some maybe applesauce in the quinoa, but I have found a lot of times food combining will cause a tummy ache in certain children. Now, just as a side note, I would start minimizing the amount of fruit juice that you give your kids, because fruit juice really is almost no different than soda pop. It's very sweet, and it can confuse the digestive system.
And Dr. Bob, don't rule out, and you know, a lot of people don't think about this, but your children have stress. And sometimes that affects the tummy also. And we use something that is an extract. It's peppermint root and leaf. And they could take some couple drops a day in their water, because it just has a minty taste and it relaxes that stomach. It helps them. It's better than peppermint candy.
Yeah, that's for sure, Deb. So I know that the digestive system can be an issue. We've talked about growing pains. So let's just say that your child says that the light really bothers their eyes. That's usually because they're consuming a lot of sugar and sweets, and it's affecting their adrenal glands. If you're noticing that your child has a lot of brown spots starting to go onto their body, it also could be because they have a compromised liver. If your child cries easy, this is also very common. It's usually a need for B vitamins. We use a product in our office called Bio-B 100s. A deficiency in B vitamins, a child will cry easy. Sometimes a child may have nightmares. You know, nightmares is oftentimes a food toxicity, and sometimes they might need to stay away from shellfish. Sometimes they might need some vitamin B6. Now you might say, well, Dr. Bob, should I give my child a vitamin, a multiple vitamin? We have several liquid vitamins on our website, and I know that if you go there or you go to the website itself and just look at some of the products that we use, we have a product called Aqua Biomulti Plus, and it is, a liquid that's very, very effective. Sometimes we'll have a patient that'll come in and they just don't seem to be healing properly. They always seem to have sores. They're just not healing. We use a liquid zinc for our children. You can see if they're tasting or they're not tasting the zinc with what we call the Aqueous Zinc Taste Test. The huge challenge that we see in our practice today are kids that have ADHD and ADD. You know, we have written this book, and wherever you're watching us in the world, we have more videos on ADHD that's available. But we have learned over time, and I could talk to you for hours just on ADHD alone, the trans fat or the partially hydrogenated oils that are inside some of the foods that we're consuming today, and most of the foods that we're consuming today, will literally cause your brain to short circuit. What I'm holding in my hand right now is a small Ziploc bag of Trix. Trix itself, wheat, sugar, partially hydrogenated oils, or trans fat. Not necessarily the best. French fries. These are plastic French fries, but you can say, Dr. Bob, do people eat plastic French fries? No. We travel with these. The average American consumes about 28 pounds of French fries per year. French fries oftentimes could have trans fat in them and can be an issue. I think, just to bring this point up to you, and I've mentioned this before, you don't want to be eating Skittles. All I want you to do is look at the ingredients. You know, Skittles itself and all the companies we ever talk about, God bless them. But what I want you to do is I want you to read ingredients. And if the ingredients say sugar, if the ingredients say sucralose, sulfate potassium, partially hydrogenated oils, if there's chemicals and food colorings that are in those products, those items can sabotage your child's ability to have optimal health. So what you might be thinking to yourself, well, Dr. Bob, what do I feed my child? Well, every day you want to start them off with breakfast. And there's so many items that you could use for breakfast. You know, you can literally make a product that we use commonly called quinoa, which is a grain. You could use gluten-free oatmeal. You could use an egg. You could use egg with a toast, preferably an organic egg. You could get wheat-free toast or gluten-free toast and put some almond butter on it. So there are possibilities. We talk about so many other possibilities in the books that we've written, but I want you to know at lunchtime, I know so many of you watching me right now, your children are going to school and they're using school lunch programs. Minimize school lunch programs if you can, and try to do whatever you can as far as having them take their lunch to school. One of the books that we've also been fortunate to write is Dr. Bob's Trans Fat Survival Guide. In this book, we talk about how trans fat impacts a child's and even your life. It could raise their cholesterol, believe it or not, and there's hundreds of thousands of kids that are already on cholesterol-lowering medication. There's also some recipes in this book, and there's menus in this book and ideas of how you could feed your child right. Your child should be on some type of oil. We use flax oil. I've already mentioned to you that we have a liquid multiple vitamin, and we also have some chewable multiple vitamins that are available on our website. Celtic sea